Well, thank you so much. Looking at the issue of brain drain in the health sector, in fact, as it is today, I can't even refer to it as a pandemic, it's a tsunami. Because we're having the best of our health professionals living in the country who have been passed through. And foundationally, when we look at it, it has to do with the funding of the health sector. Because over the years, successive administration in the country at the federal, state, and local level, because the issue of healthcare has to do with the totality of the government, whether national or subnational level. So the lack of adequate or proper funding of the sector in terms of, because if there are proper funding, definitely there will be the right infrastructure to work with, then the welfare of the personnel, the health professionals, the health workers will be adequately taken care of. Because when you look at health workers, they are at the front line of ensuring that diseases, sicknesses are addressed using the basic needs of the person or the consumer of healthcare services. So it means that their welfare is very important. So there must be adequate remuneration, even in accordance with International Labour Organization Convention 100, and that talks about equal remuneration for work of equal value. And the provision of that convention also went for that to say that your remuneration should be tied to the service you are rendering. Okay, so when you look at the services we render in the health sector, it is so enormous that health workers have to give in the totality of themselves, the totality of their being to provide health care. They deny themselves sleep at times, go on call, shift duty, a lot of activities, even outside their normal work hours that they carry out to save, especially emergency health situation. So the issue of funding is tied to one, provision of adequate remuneration, welfare services for the workers in the sector, and then infrastructure. So when these two things are lacking, then you leave the health workers with no option than to assess opportunity where some of these things are provided. And take for instance the UK system, United Kingdom National Health System today provide adequate remuneration for health workers. And that is why you see health personnel, you see pharmacists, physiotherapists, medical doctors, you see nurses going there. In fact, what happens in the UK system now, the health system, is that they will provide employment for them before they get to the United Kingdom and provide accommodation. So one of the things foundationally that even adequate funding can provide is that make sure that you provide services like social services that will make health workers not to be far away from the facility, which include housing. There must be housing provided for health workers, categories of health workers, within and around the hospital so that they will not be too far away from the hospital. And of course, such housing provision should be able to be decent, because we talk about living in a decent environment, especially those in the rural areas. Talking about primary health care now, because most health workers don't want to go to the rural areas because of lack of basic amenities and all. So if you provide, take for instance, a staff quarters within the hospital that have basic social amenities, those things that can, encourage, health workers to provide the best of their services, they will have no need to go to any other country for such thing, because what they will have ordinarily go to seek for in UK, in Canada, in US, are already provided for them in Nigeria. Something pushed them out of the country. Let the government address what pushed them out of the country, so that they will be pulled back because situation has improved. In fact, one of it, apart from all this remuneration, is insecurity. But we have some health professionals being kidnapped by kidnappers and take to this to be treating kidnapped victims. You understand? So government must show that way to say that, look, they must see something that is happening that has improved on the socio-economic condition that led them out of the country to pull them back. Okay? That is very critical. Like I do say, when people say presidents will go and woo foreign direct investors, I say we don't need that. If the country is good, people will be begging to come to Nigeria to come and invest in Nigeria.
You don't make advertisement.
We don't have to go and tell them that we have lithium, we have this. These are the people stealing our thing without payment.
Good palm wine sells itself.
So you are even telling them to come and loot the thing. They are coming to loot our resources, our natural resources. Okay? If not that, I think government is putting some policies in place, solid measures to ensure that there are licenses that are given to people. But the people you are telling to come and invest in all these things, even come to Nigeria and take these things away free of charge. So we must provide that enabling environment that will pull them back, that will attract them back to say, no, we are coming back home. There are countries that have survived such kind of things. And there are people who are returning back home. People who left now see that the country is safe for them. They now feel that the country has provided certain things that will help them to advance, and their socio-economic well-being will be improved upon. So for people who have left, like there must be a pull factor in Nigeria. Then the issue of brain gain, like I said, is in two ways. We are a member of the United Nations Organization. Nigeria is a member, signatory to so many treaties, and we can have a bilateral agreement with the United Kingdom. Okay, people that are leaving, this is what should be paid back to Nigeria. You understand? To also help the Nigerian economy.
To trade more, possibly.
Or to trade more. Exactly. Thank you. Because the resources will be plumbed back to that same sector. Then another thing is that this issue of transfer of technology, we should be looking at it because we must have a robust system for exchanges. There's nothing bad in the country having exchanges in terms of human resources. It helps also to improve on the quality of human resources and then technology in that country. China did that, and that's why today China is a country that is competing favorably in the United States. But at the time, some of their human resources were sent to the US to study and also to work, and they acquire knowledge and return back. So that's why at times people give narrative that you can steal technology, you can borrow technology, you can transfer technology. So we must look at it that, okay, people who are even going, since we have limited state-of-the-art facilities now, if they gain such experience, then they can come back and also suggest to us how we can acquire some of those facilities to meet the needs of Nigerian citizens.